Infected cuts or sores on a food handler's hand can result in A. Slower food preparation. B. Spread of harmful germs to food. C. A fine from the health department. D. Reduced efficiency at work. Answer B. Harmful germs from an infected sore can transfer to food, causing contamination. Proper hand washing includes A. Using cold water and drying with a cloth towel. B. Using warm water and soap for at least 20 seconds. C. Scrubbing hands with sanitizer. D. Rinsing hands quickly under running water. Answer B. Hands should be washed thoroughly with warm water and soap for at least 20 seconds to remove germs. Bare hand contact with ready-to-eat food is prevented by A. Washing hands only once per shift. B. Using utensils or single-use gloves. C. Using hand sanitizers after touching food. D. Wearing gloves without washing hands. Answer B. Utensils or gloves should be used to avoid direct contact with ready-to-eat food and prevent contamination. Foodborne illness can be caused by A. Eating in the food prep area. B. Using a metal thermometer. C. Germs, chemicals, or toxins in food. D. Overcooking food. Answer C. Contaminants such as germs, chemicals, or toxins can cause foodborne illnesses. The temperature danger zone for bacteria growth is A. Between 41 degrees Fahrenheit and 135 degrees Fahrenheit. B. Between 60 degrees Fahrenheit and 140 degrees Fahrenheit. C. Below 32 degrees Fahrenheit. D. Above 160 degrees Fahrenheit. Answer A. Bacteria grow rapidly within the temperature range of 41 degrees Fahrenheit to 135 degrees Fahrenheit, making it critical to keep food outside this range. Cross-contamination happens when A. Different types of raw meats are stored separately. B. Utensils are sanitized after each use. C. Germs from one food item transfer to another. D. Food is cooked to the proper temperature. Answer C. Cross-contamination occurs when harmful microorganisms from one food or surface are transferred to another. Improper cooling of food leads to A. Enhanced flavor and texture of food. B. Faster preparation for the next serving. C. Reduced cooking time in future meals. D. Growth of bacteria and production of toxins. Answer D. Slow cooling allows bacteria to grow and produce toxins, which reheating cannot destroy. Refrigerators must maintain a temperature of A. 45 degrees Fahrenheit or above. B. 32 degrees Fahrenheit exactly. C. 41 degrees Fahrenheit or colder. D. 50 degrees Fahrenheit for safety. Answer C. To prevent bacterial growth, cold foods must be kept at 41 degrees Fahrenheit or below. Food left in the danger zone for over 4 hours should be A. Reheated to 135 degrees Fahrenheit. B. Cooled to below 41 degrees Fahrenheit. C. Discarded to prevent foodborne illness. D. Frozen immediately for later use. Answer C. Food that has been in the danger zone for more than 4 hours must be discarded, as reheating cannot destroy certain toxins. Hand washing is required after A. Touching sanitized equipment. B. Drinking water. C. Handling raw animal products. D. Using a thermometer. Answer C. After handling raw animal products, proper hand washing is crucial to prevent the spread of bacteria. Sanitizing kitchen surfaces effectively removes A. Dust and dirt. B. Bacteria and other pathogens. C. Odors and grease. D. Stains from spills. Answer B. Sanitizing helps eliminate bacteria and other pathogens, ensuring food safety. Food handlers with symptoms like diarrhea or vomiting must A. Inform the manager but continue working. B. Avoid working until 24 hours after symptoms stop. C. Drink water to reduce symptoms. D. Wear gloves to handle food. Answer: B. Food handlers must stay away from work until at least 24 hours after symptoms like diarrhea or vomiting have stopped. Hot food must be held at A. 135 degrees Fahrenheit or hotter. B. 145 degrees Fahrenheit or lower. C. 100 degrees Fahrenheit or higher. D. 120 degrees Fahrenheit to maintain flavor. Answer: A. Hot foods must be held at 135 degrees Fahrenheit or higher to prevent bacteria from growing. Reheating food requires reaching a minimum temperature of A. 145 degrees Fahrenheit in 30 minutes. B. 120 degrees Fahrenheit to avoid overcooking. C. 110 degrees Fahrenheit before serving. D. 165 degrees Fahrenheit within 2 hours. Answer: D. Reheated food must reach 165 degrees Fahrenheit within 2 hours to ensure safety. Gloves must be changed. A. After touching sanitized equipment. B. After handling raw meat. C. After taking a short break. D. Every 2 hours during a shift. Answer: B. Gloves must be changed after handling raw meat to prevent cross-contamination. Cooking ground meats to 155 degrees Fahrenheit ensures A. Destruction of harmful bacteria. B. Preservation of flavor. C. Prevention of overcooking. D. Retention of nutrients. Answer: A. Cooking ground meat to 155 degrees Fahrenheit ensures harmful bacteria are destroyed. Food contaminated with bacteria may A. Appear, smell, and taste normal. B. Look discolored and smell bad. C. Have a sour taste and texture. D. Be slimy to the touch. Answer: A. Contaminated food may look, smell, and taste normal, making it important to follow food safety practices. Using a metal stem thermometer in food helps A. Ensure it reaches the correct internal temperature. B. Improve the taste of cooked dishes. C. Speed up the cooking process. D. Measure food weight accurately. Answer: A. A thermometer ensures food reaches the proper internal temperature, critical for killing harmful bacteria. Frozen food must be thawed. A. At room temperature for even thawing. B. On the countertop for faster defrosting. C. In warm water to speed up the process. D. In the refrigerator to avoid bacteria growth. Answer: D. Thawing food in the refrigerator keeps it at a safe temperature to prevent bacteria growth. Gloves should be discarded. A. If they become soiled or torn. B. After handling sanitized equipment. C. After performing the same task repeatedly. D. After wearing them for 2 hours. Answer: A. Gloves must be discarded when they are soiled or torn to maintain food safety. Food cooling should be done in A. Large containers to save space. B. Shallow pans to speed up cooling. C. Covered containers to maintain freshness. D. Airtight containers to prevent contamination. Answer: B. Cooling food in shallow pans allows for faster cooling, reducing the risk of bacteria growth. Ready-to-eat food contaminated with raw meat should be A. Refrigerated immediately. B. Heated to 135 degrees Fahrenheit to kill germs. C. Thrown away to avoid illness. D. Washed and served. Answer: C. Contaminated ready-to-eat food must be discarded to prevent foodborne illness. Time/temperature control for safety, TCS, foods must be A. Held at proper temperatures to prevent bacteria growth. B. Stored at room temperature. C. Kept at 60 degrees Fahrenheit to ensure quality. D. Cooked only for special occasions. Answer A. TCS foods must be held at the right temperature to prevent harmful bacteria from growing. A person in charge, PIC, in a restaurant is responsible for A. Managing finances. B. Enforcing food safety rules. C. Scheduling employee shifts. D. Preparing food. Answer B. The PIC is responsible for ensuring that food safety regulations are followed by all employees. After washing utensils, they must be A. Rinsed and sanitized before use. B. Stored without drying. C. Used immediately. D. Wiped dry with cloth towels. Answer A. After washing, utensils should be rinsed and sanitized to remove any remaining bacteria. Employees sick with vomiting or diarrhea must A. Report the illness to the person in charge. B. Continue working with a mask. C. Take a break and rest. D. Drink fluids and return to work. Answer A. Employees must report their illness to the person in charge to prevent the spread of germs. A food thermometer is used to A. Measure the thickness of meat. B. Check the internal temperature of food. C. Improve the appearance of food. D. Speed up the cooking process. Answer B. A food thermometer ensures that food reaches a safe internal temperature to kill harmful bacteria. Hot holding equipment must keep food at A. 135 degrees Fahrenheit or higher. B. 120 degrees Fahrenheit or higher. C. 110 degrees Fahrenheit or higher. D. 150 degrees Fahrenheit or higher. Answer A. Hot holding equipment must keep food at 135 degrees Fahrenheit or higher to prevent bacteria growth. Food in the danger zone for more than 4 hours. A. Can be reheated to 165 degrees Fahrenheit. B. Must be discarded. C. Can be cooled quickly to 41 degrees Fahrenheit. D. Should be served immediately. Answer B. Food left in the danger zone, 41 to 135 degrees Fahrenheit, for more than 4 hours must be discarded to prevent illness. Gloves can spread germs if A. Used for multiple tasks without changing. B. Removed and disposed of properly. C. Used for handling raw meat only. D. Used only with dry hands. Answer A. Gloves should be changed between tasks to prevent the spread of germs, especially when switching between handling raw and ready-to-eat foods. A clean and sanitized work surface prevents A. Cross-contamination. B. Faster food preparation. C. Improved food texture. D. Extended food shelf life. Answer A. Cleaning and sanitizing work surfaces help prevent cross-contamination between different foods. Single-use gloves should be A. Used once and discarded after handling food. B. Used for multiple tasks during a shift. C. Washed and reused to save cost. D. Worn only during meal service. Answer A. Single-use gloves should be discarded after handling food or when switching tasks to maintain hygiene. Chemicals in a food service area should be A. Stored above food items. B. Clearly labeled and stored away from food. C. Kept in unmarked containers. D. Mixed with water and stored near food preparation areas. Answer B. Chemicals should always be clearly labeled and stored separately from food to avoid contamination. Food that has been contaminated must be A. Refrigerated until further notice. B. Washed thoroughly and reused. C. Discarded immediately to avoid illness. D. Heated to 165 degrees Fahrenheit to kill germs. Answer, C. Contaminated food must be discarded to prevent the risk of foodborne illness. To prevent bacteria growth, cold food should be held at A. 41 degrees Fahrenheit or below. B. 45 degrees Fahrenheit or below. C. 50 degrees Fahrenheit or below. D. 55 degrees Fahrenheit or below. Answer, A. Cold food should be held at 41 degrees Fahrenheit or lower to prevent bacteria from growing. The final step to removing bacteria from surfaces is A. Washing with soap and water. B. Drying with paper towels. C. Sanitizing with an appropriate solution. D. Using warm water for rinsing. Answer, C. Sanitizing is the final step in removing bacteria from surfaces to ensure they are safe for food preparation. Raw meat should be stored A. On the lower shelves of the refrigerator. B. Above ready-to-eat food. C. With fresh vegetables to save space. D. On countertops to thaw properly. Answer, A. Raw meat should be stored on lower shelves to prevent drips from contaminating ready-to-eat food. Hand washing is necessary after A. Handling money. B. Drinking water. C. Touching your face or hair. D. Using hand sanitizer. Answer, C. Hands must be washed after touching the face or hair to prevent contamination of food and surfaces. Utensils used to handle raw meat must be A. Washed, rinsed, and sanitized before reuse. B. Stored for later use without washing. C. Wiped with a clean cloth before reuse. D. Used continuously without interruption. Answer, A. Utensils used to handle raw meat must be thoroughly cleaned and sanitized before being used for other tasks to avoid cross-contamination. To avoid contamination, ready-to-eat food should be handled using A. Bare hands. B. Tongs, spatulas, or single-use gloves. C. A clean cloth. D. Disposable napkins. Answer, B. Ready-to-eat food should be handled using utensils or single-use gloves to prevent contamination.